The last factor influencing distribution of drug is placental transfer of drug. Placental transfer of drugs, or we call it placental barrier. Here is placenta, and here is placenta villi, and here is uterine blood sinus. Placental barrier is between placenta villi and uterine blood sinus. Here is placenta villi. Placenta blood circulation is through umbilical cord. The transfer of drug across placenta is of critical importance because drug may cause anomalies in the developing fetus. Administer immediately before delivery, as is often the case with the use of tacrolides in the treatment of preterm labor. They also may have the first effect on neonate. The fetal plasma pH is 7 to 7.2. Mother plasma pH is 7.4. Lipid solubility, extent of plasma binding, and the degree of ionization of weak acids and bases are important general determinants in drug transfer across the placenta, so that ion champion or basic drug occur. The fetal plasma is a little more acidic than mother plasma, so basic drug is more easier to be trapped in fetal body. There is a P-glycoprotein and other export transporter in the placenta. This functions to limit fetal exposure potentially toxic agent. The view that the placenta is an absolute barrier to drug is, however, incompletely inaccurate, in part because a number of influx transporters are also present. The fetus is to some extent exposed to all drugs taken by the mother. True or false? 1. The placenta is an absolute barrier to drug. The answer is false. 2. The fetus is to some extent exposed to all drugs taken by the mother. The answer is true. 3. Strong acid and basic drug is more easier to pass through the cell membranes to be absorbed. The answer is false.